Well, hello everyone. I'm glad you could join us tonight. We're going to have an exciting webinar. We've got a few guests. Unfortunately, there was a sickness in the family, so she won't be able to join us. But we have a good lineup, and I'm hoping that you will be able to learn more about PBM and how it can help those that you know. Not only your loved ones, but also friends and family. So right now we're going to go over to our video and Sam.
PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's a sun, but that light comes through the skin layers and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can.
Well, hope you enjoyed that. So tonight we have different guests. One that I've known for quite a length of time. His name is Rick Polson. And Rick, if you want to turn on your video. So Rick and I go back, I don't know, it's got to be about 16, 17 years ago. And he was able to start learning of the benefits of PBM only a short time ago, because it took him a while to believe that light could do anything as far as just light only. So Rick, Rick is joining us from Costa Rica. So how you doing, Rick?
Very well, thank you. And wondering how I can help you.
Anyways, so as far as you worked with me in the little while ago or earlier with the first was the Genesis light. That's the big bulky ones, and then more recently you were able to get the smaller palm lights. But I remember you having an incident where you hurt your ribs pretty bad. So tell me about that. What happened?
Oh my. Well, someone chased me with a machete. And I ran away from that, but then he threw something at me, I blocked, and he hit my ribs.
Yeah, and then you put the light on your ribs.
It was broken, or something was, I don't know what happened to it, but sure hurt. It hurt a lot. And I fell asleep with the light on it, and I woke up pretty hot, but that was the end of the pain.
Yeah. Yeah, and the healing from that. And then you had another incident with the tractor where you decided to drive over your foot. That wasn't so good.
Yeah, no, a branch sort of knocked me sideways, and I put my foot down, and the tire grabbed it, and I thought, oh no, it's going to rip my leg off. But at the same time, the branch throttled the throttle right down, and so I was able to think quickly and get it into reverse the tractor with my hand instead of my foot. But it was yeah, that was a pretty bad situation. And so I when I figured out I could still move my leg, I got home and got alternated ice and light. And I was surprised that within a week or two, I was walking and getting around. And I can't say what would have happened without it, but I'm sure it would have been a long time.
Yeah.
Come back.
And remember the time with your dog? You were able to treat your dog with I forget what it got into a fight, or what was it that you used the light on?
Well, that case was photodynamic therapy.
Okay, that was to kill the infection.
It was a horrible infection from a coyote attack.
Right.
I was able to get the dog out of the coyote's mouth, and I got it home, but it was a sad puppy. It looked about twice the size. It swelled up so much with an infection, and I lifted it up, and the pus poured out of it. But these bacteria can be treated with the photodynamic therapy, and then
right,
and then
yeah, that's just for some of the listeners that are unaware of that. There's a treatment where a person can use light and a special compound, and when the light reaches the area of the infection, it helps to kill. It's a very strong oxidizing mechanism that kills the bacteria in the area. So he was able to save a small pooch, and that was great. That was neat. You sent me some pictures, and I was pretty happy to see. But you've been able to use the light a number of times on different things, and been able to see how that can help. You've done research before, but more recently you got into a little deeper as far as learning of some of the mechanisms why light can on its own can be so beneficial.
Well, I wasn't sure just how photobiomodulation worked, and because even in the scientific journals, it seemed to be the evidence was more anecdotal than scientific. I had my doubts until I talked with Dr. Pravina Rani, and he straightened me out a bit. But what I'm finding now is it is compatible. It supports the work of photodynamic therapy, and we're trying several ways that it's helping out.
Mhm.
For instance, there's a cancer lysis syndrome, where the cancer cells that are destroyed, release their cellular contents into the body, and you feel really sick. And that's whether you've done photodynamic therapy, radiation, or chemo. You feel sick from that. And the photobiomodulation can help a lot.
In helping the lymphatic system to push out the toxins
Well,
and everything.
that's another element of it. It does help soften, I say it this way, soften up the lymphatic system so that it can eliminate the toxins.
Mhm.
And the toxins that do get into the liver and cause an abundance of liver enzymes, and that can cause, like, call it a weak liver. The photobiomodulation can strengthen that liver. What it does is just help the cells produce more energy to function the way they should. And it's a tremendous support. And so what happens, because Tom, you generously sent me some lights, hoping I would see how they could be used. My
Yeah.
only problem is that I keep lending them out, and then I have to track them down. And I would say that for anyone who is like, I can see it where a doctor, there's so many ways it can be used in some parts of it, or a dentist, or a physiotherapist.
Mhm.
You've got to have half a dozen of those lights, and you've got to make sure you write down who you gave them to.
Okay. Well, Rick, I really appreciate you coming on tonight with us and sharing just a little bit for some of the guests here to
Appreciate.
learn how PBM can be helpful. So thank you for joining us from Costa Rica today.
Thank you for having me.
Okay. So yeah, so thank you, Rick. Okay, so the next the next video that we're going to play is actually an interview that I did with a he's an announcer, talk show host by the name of Neil Boron, and he had COVID, really bad lungs, and was with a low oxygen of 79, 80. And we were able to connect. So we're going to play this next part of the video now of my interview with him. So tell me a little bit about your situation. We both ended up with COVID at pretty much the same time, and I had just finished improving very quickly with using the mini canopy, so shooting a large area of my lungs front and back. My blood oxygen going into this was 80%, and I had significant deterioration of my lungs, compromised lungs, and the x-ray showed that I had double lung pneumonia. And so it was at that time, January of 2021, I started using the light front and back as soon as I was discharged from the hospital. Thankfully, I was only at the hospital for a few hours, well, maybe 8 hours, I think. But then I could start using the light at home, and I did. And that's when I heard on the air something about you having COVID and that you weren't doing so great. So since we had connected with each other a few times, I reached out to you. So
and thank you for doing that. Yeah, I made it through 2020 without, getting COVID, but I guess it was at the end of 2020, Christmas Eve, we had the family over. My son Zach said he didn't feel well, so he was sitting off to the side of the room near an open window, just trying to not get anybody infected with whatever he had. Turns out he had COVID, and he gave it to my wife and I, Mary and I. So, we got sick maybe the day after Christmas or so. Just all of a sudden got whacked with COVID, and for the next really 2 weeks, just trying to cope with all that. I think my wife got better more quickly than I did, but it was the lung issue because all the aches and pains and the fever and all that stuff, it took 7 to 10 days for me to get past most of that. But what was happening was when I would breathe, I wasn't getting any benefit out of the breath. My oxygen content in my blood was somewhere between 79 and 82, which was shockingly low.
Yeah.
So we
It's a very bad level.
actually called, for an ambulance on 3 different occasions. Each time they talked us out of that simply because of the state of the hospitals wasn't good. I mean, you were going to go to the hospital and sit in a hallway for 4 days before anybody would even see you. And they said, as long as he's not delirious and as long as he's, stable, like treat him at home, just do what you can to take care of him here. And somewhere in there, you heard about my situation.
Yeah.
I think it was that my son, who also Zach works at WDCX. I think he mentioned it on the air. I'm pretty sure that's how it happened. You heard about it. You then had someone over in States bring me one of your units,
Yeah.
Kind of a palm-sized,
Yep.
what you call it, but yeah, one of those.
One of these guys here.
Yeah. So, the one setting deals with more topical kind of stuff.
Yeah, this is the red, and this is the near infrared wavelength there, and that's the one that Neil would have been using. It's the dim setting.
Right.
Yeah.
But it penetrates.
Yeah.
So I was putting it on both sides of my chest, and then my wife Mary would put it on both sides of my back to be able to get to the lungs as best as possible. So, 30, 40 minutes a day, several times a day, I was doing that. And what happened was that I wasn't improving for a period of time till I got that unit. Once I started using it, the improvement was almost instantaneous. Now I didn't all of a sudden have 99 to 100 oxygen
Right.
content. It took a period of time, but every day you could see it inching up. And so I was out of the 70s into the low 80s, then the mid 80s, and then the upper 80s. And that was pretty encouraging. And in a matter of about 3 weeks, I was back into the mid to upper 90s. And, I'm just so grateful that I had the opportunity to even know about it or use that, because I don't know what would have happened long term. I wasn't improving. I was out of work for the entire month of January that year. And so we were sick at the same time.
Yeah, exactly.
But you were helping take care of me, and I didn't know what I could do for you except pray.
Which is perfect.
Yeah, but we both got better. But I credit my turnaround to the use of light therapy. It was incredible.
Yeah. And then your wife has also had a chance to give it a try for.
Yeah, she's had trouble with her right shoulder and has experienced, pain and lack of movement and that kind of thing. And she's been able to use it on her right shoulder, and it's provided quite a bit of relief, pain relief, and also greater mobility. So, we're grateful for that. I don't know what kind of pain or swelling, she really has. She's been to physical therapy, but no one's ever diagnosed that she has a partially torn, rotator cuff or anything. She has no official diagnosis except that she has pain and lack of mobility in her shoulder, but it's been used to really help loosen up that situation
And get the mobility back.
Yeah. So I'm a firm believer that there's value in light therapy and that it can be used to really, in fact, during one of our radio shows recently, we were just asking people what they're thankful for. It was a day where we had a cancellation and we had other things planned, but we just decided to scrap it and say, hey, listen, let's talk about what we're grateful for right now. There's a lot of problems in the world, a lot of things to complain about.
Lots of problems.
Let's talk about what we're grateful for.
Yeah.
And of the phone calls we took that hour, I think we took 8 phone calls. 2 of them referred to using that same unit that I have. That they had somehow heard your commercials on WDCX, had gotten a hold of the system that you have available, and had experienced tremendous healing in their body as a result. So it was like even more confirmation that this was being used to help people get better, reduce pain and swelling, and promote healing.
Yeah. Well, there you got a chance to hear how the light therapy using one of the palm lights was able to help Neil Boron and his situation with having challenges with his lungs because of COVID, and also how I was able to improve my situation as well using the light. Well, next we have the next guest we have is Mike, and Mike has recently been able to get one of our lights, and he's just going to come on with this video in just a moment. We have a number of dentists out there as well that are joining us today. and just want to welcome all of you as well. There's a number of facilities that are using doctors' offices and dentists that are using our light. So anyways, now we turn it over to Mike. Hi, Mike. How you doing?
Hi, Tom. Can you hear me?
Yes, we can. Excellent. Okay. Well, I'm glad you could join us. So it was a little while back that I was able to meet you guys at a meeting, and I explained to the group of people about light and what it could do. And you thought you'd give it a try. What happened? I think you even tried it that evening, did you not? Or was
I did, Tom. Yeah, prior to that meeting, I had no idea this technology was even out there. And that was probably about 6, 7 weeks ago. I think maybe 6 weeks ago. And what had happened was Tom had a demo at this meeting, had all different kinds of lights, and he was explaining that technology. And I wasn't even going to go that night because I had back pain, like severe sciatic pains down my legs, and I wasn't even going to go, but I ended up going anyway. And then Tom had someone with him that offered, to do a demo on me, and I said, oh, absolutely, let's do it. So I think they used the 12-inch by the 16-inch screen,
Yeah.
or light, something like that.
Yeah, both
And they
12
just
by
put that
14.
on my
Yeah.
put that on my back for probably 20 minutes or so. And I just couldn't believe it. I just thought, wow, I'm a pretty physical guy. I'm working construction. So, to have a solid back is really important. And, and it's definitely, so what I did was I've purchased one of the Ultimate Palm, I guess it was. And I use it every day if I need to. And like it's helped tremendously. Like now I'm pretty much back to normal. When I first purchased it, I used it probably 3-4 times a day. But I've also am changing my lifestyle as well, watching what I eat, physical exercise, getting lots of good sleep, eating good food, and definitely SunPower is definitely a tool to have in my arsenal for sure.
Yeah, and it's really, really hard to do exercise if you tried to do that before you had the light treatment. It's so painful. It's hard to move. You don't
Oh,
want to do
absolutely.
it. And
Yeah, just little bits, and just this past weekend, we were cutting a porch off a roof, and it fell on my arm, and I thought, man, I almost broke my arm, but nothing had broken. But right away I put the light on it, and it's only been a day or so, 2 days maybe, since that's happened, and pain's pretty much gone. So it definitely increases for sure.
That's beautiful. Well, I'm so glad, Mike, you could come on and share. Oh, did your wife end up using it as well, or anybody else in the family?
She's using it now for her back as well, so she's currently using it. Yeah.
Beautiful, beautiful.
Yeah.
Well, okay. Thank you very much, Mike, for coming on. Really appreciate it.
No problem, Tom.
All right.
Thanks a lot.
Okay.
All right. Bye now.
So I'm glad you were able to hear how dramatic it was. It was the mini canopy, which I'll show you in a few minutes, as far as how the mini canopy that he used was able to change his back situation over dramatically. The nice thing about it's such a large area. But just to come back because I got a little off track there, but so we have the professional is the beginner model that we have. Beginner, it's a really good unit, no doubt about it. But it's we have the 2 wavelengths, and the reason why we would have 2 wavelengths is 660 nanometer has a big influence on the blood, and so if you had to go to a target, let's say a deeper shoulder injury, the 660 probably would not reach to the depth. But when it comes to, but it would influence the blood would actually absorb that wavelength. And when it does, the mitochondria actually absorbs it and gives energy to the cell. And because you're influencing the blood carries around. So there's that benefit. But when you go to the 810 nanometer, that has a different set of things. There's some overlapping, but there's some other effects as well. So in this case, the 810 has the potential to penetrate much deeper. Now, it would be like you can see here how the red light is penetrating right through my hand. Now, if this camera could pick it up, you would actually see the light coming right through my hand, even brighter. But it's because the camera can't pick it up, neither can your eye pick it up, but the energy is there, and you just feel a nice warmth. So we have that model, and that's 975. We have the what we call the Ultimate, and the Ultimate has the same two wavelengths, the 660 nanometer and the 810 nanometer, same thing. Only thing is that it's got more power, and more power can help penetrate a little deeper, but it also can help to accomplish the task faster. So it'd be kind of like having a pickup truck with a 4-cylinder engine in it, and you have it fully loaded in the back box. If you tried to go up a long hill, it's going to take you a long time, to go up that hill. But if you had an 8-cylinder, you would be able to get there that much quicker. Now, at this point, I want to mention too, there's a lot of different light products out there, but they would be like if you tried to have a 4-cylinder pickup truck, but only 2 of the cylinders were running. You may get it up the hill, and then you may not. There's just not enough energy there to do what you need to do. So these are really not toys, but medical devices that have quite a bit of optical power. So I have, for those that are interested in specifications, this unit here has over 100 milliwatts, actually 150 milliwatts per square centimeter of energy coming out of this over that full area. And the thing we do is we also have such an even amount of light, we call it a wall of light that's coming through, and that allows you to go even deeper. So that's what we have with the Ultimate. It's selling for $1,300, and then we have the our most recent device, which we call the Super Palm, which still has the 660 nanometer, but instead of the 810 nanometer, we have 1050 nanometer. Now the 1050 nanometer is totally invisible to our eyes, but it's possible that 1050 can penetrate even deeper. And it also works on, there's research out there by Dr. Michael Hamlin about how this could actually cause something called structured water that helps the cells in the way that the fluids move in the cells. But so it has the 1050 nanometer. Now you see the one bright red light here, but that's just an indicator. These other lights are in my eyes, I can't see them at all, but the camera is actually picking it up. So that's the 1050, and that's $1,900. So we have the different devices, and as you move up the chain, there's a possibility of even penetrating deeper and getting the job done faster. Now, I know that there's quite a number of dentists on tonight, and I wanted to mention as well I have a number of dentist offices using our devices, and what we've added is an intraoral probe. It's a little adapter with an optical probe on it that allows you to go inside the mouth and treat in the back of the mouth where you're doing your work. It's possible to not only reduce pain, but it's also if a person is dealing with abscess teeth and it can actually help with the bacterial infections and also all sorts of things with the lips. There's a whole area of what's called oral mucositis, which some of you would be aware of, is where a person who undergoes chemotherapy can end up having really bad, they're in bad flesh. They're inside their mouth, the layers of skin, because they're very fast producing cells, they deteriorate, and it's just like you have one continuous sore ulcer, however you want to look at it. But it's so bad that people on chemotherapy can't continue their treatments. And the nice thing that PBM has been able to show, and there's a lot of research out there that shows that this can totally eliminate the possibility of oral mucositis for those that are undergoing chemotherapy. And if you are undergoing chemotherapy, it's possible to to repair the mouth. That's really what light also does, is not only does it give it the energy to the cells, but once the cells have all that energy in the mitochondria, which is actually like the power plant of the cell, it allows then the cells to help promote healing. And that's pretty big. Well, very, very important to the body. So whether it's healing on the top of your head, to the bottom, soles of your feet, anywhere where you have cells in your body, which is everywhere, this light technology can be helpful. We do have on our website, SunPowerLED.com. We have a link under resources where you can go to a Substack and learn all about, like if you're one that wants to get into the research as to why does this all work. There's 7,700 studies there that have been done around the world on why light therapy for different mechanisms, whether it's burns, how you can speed up the healing of burns, whether it's inflammation, reducing inflammation in joints, and a whole host of different indications can be helped by using light therapy. So we also have, of our products, we have what's called the helmet. And the helmet is this device here. And this device has got 10 of the palm lights all around. And a person would just put their head in there, and it would just be lowered down to the on top of their head. And it has the two wavelengths as well. It has the 660 nanometer, and you can see the 810 nanometer. We have seen some really, really neat things when it comes to people who've had stroke or concussion. There has been some really fantastic people out there that have done a lot of research with the helmet, not necessarily my device, but with other LED devices. And I have videos on my website as well for those that have been, are really the leaders that we're standing on their shoulders because of what they did. So there's like Margaret Nasser, there's Michael Hamlin. There's trying to think of in Australia, but there's quite a number of researchers that have shown why light can actually penetrate the skull and help with all different kinds of conditions like concussions. And there's more and more research coming out for other types of indications with the mental stuff. And so I'm all of a sudden gone for a loss on that one, but definitely concussions, strokes, dementia, Alzheimer's, are all things now that are showing great promise in being able to help actually slow down or even stop and reverse and heal parts of the brain. So one of the individuals, Dr. Praveen Irani in University of Buffalo, treated an individual who had strokes with, seizures. And when he did after 2 months, he was doing the light therapy treatments at University of Buffalo. He was able to be free of seizures for about 2 years. And then that was during COVID that he had once again, had the seizure come back. And at that time, because of the lockdowns and everything that were occurring, Dr. Rani suggested that this individual, Josh Bowers, actually should try this light. He was another associate professor at University of Buffalo. Should get one of the lights from me. And he started using the light, and he was able to be now totally seizure free for the last 2 years. And there's been others that have had migraines, severe migraines, that are totally migraine free right now because of the light technology, using the palm light for treatment. There's quite a number of other indications as well for light therapy, even those that, as we mentioned in the video earlier, those that have had COVID on their lungs. We got everything ready for a larger trial in 3 hospitals using near-infrared light to help those with inflammation in the lungs. So it's possible. So the unit that I ended up using in my situation was this device here, which is called the mini canopy. It's much larger, as you can tell, than the palm light, and you're talking about 15 times the area. So in our video here, the fellow Mike had used this on his back, and you can see where that has quite the advantage to be able to treat such a large area. So you can treat all the muscles in the area. And actually, there's something to the fact that as the area increases, you actually end up helping with depth. So in this case, the light device here that we have has the 2 wavelengths. There's the 660 nanometer wavelength, and there's the 810. And you really can't see, there you go. I guess if I shade it out a little bit, you can see the little bit of lighting, but it's just because our eyes can't pick that up at all. So we have this device as well, the mini canopy. We also have one other device, larger, which is 6 of these. So it's in a 2x3 area. So it's 2 feet by 3 feet. So it can do, for a clinic, it can do a whole area of the back, back and neck in one shot, and with a very high light level. So we're still looking at over 100 milliwatts per square centimeter with this device, which is substantial to be able to treat deeper into the body. So at this point, we have these different devices, and I'd like to start answering some questions that are there. Thank you to everyone for sending us some questions here. So Terry asks, have you seen results for osteoarthritis in the hip? I would like not just to take the pain away, but to heal the hip so I don't need surgery. Which product would you recommend to heal my hip? Actually, a very good question. And yes, with different forms of diseases like osteoarthritis, it's possible to not only reduce the inflammation, and when you reduce the inflammation, you can help reduce the pain. That's one. But now you can promote healing in the area. So it's very much a wellness aspect to do everything possible. Now, you need to also complement that, Terry, with good health as well. And I know we all like our things to eat, but it's also very important that you look at whatever you can do on the area of your eating habits to try and improve what you put into the body will also help. But for sure, we've had the light can reach the area of the hip and help that. And so we had one individual that had arthritis in both knees and they told the only thing that could help her and was going to be surgery in both knees. And she was able to totally avoid all surgery. And when she first came in, she was walking with a walker and having difficulty getting around and extreme pain trying to go in and out of a chair. And she used the light daily. And in about 6 months' time, she was able to walk around without a walker and without that pain. So it's possible to help put the healing mechanisms in, help the healing mechanisms in your body to start working on those areas and improving the quality of life. I can't say for sure that you're not going to need surgery, but there's a good possibility if you started going after this that you could hold it off, or maybe it's not. Maybe you're going to also totally heal as well over time. But that is everybody's body is different, and as I mentioned, it depends on also what you're putting into the body. Okay. Hi, Jennifer. This is from Beth. Hi, Jennifer. Tom, any chance there will be a great Black Friday deal this year? I can't say for sure. We're considering it, so I will have to get back to you on that. Okay. Okay, good question by Jodine. Have you heard from people for whom PBM does not work? If so, why is this? Well, I can tell you that it does require to be consistent. And, we don't think about it, but we eat 3 times a day. And if you don't eat for a week straight, it's going to be pretty rough. And I got to say, one of the difficulties with PBM is when you don't use the light. Or you're like my friend. One time I gave it to him, the unit to use, and it was in a little bigger box. And the next time I contacted him, he had broke his toe. And I said, I called him a few days later, and I said, and he was in a fair amount of pain. And I said, so how did how's it working? And he says, well, your unit caused me a lot of pain. And I was like, I'm sorry, how is that possible? It should reduce the inflammation and that. And he says, well, actually, I had it in the box beside the bed and I hadn't used it. And he says, I ended up forgetting it was there. And as you know, guess what toe hit the box and kicked it across the room was his toe that he broke. So it was still in the box. He had not pulled it out. These units will not work at all if you keep them in the box or in the desk. But they work quite well. I don't know. I've seen most people are able to respond very well with the use of light. It's very rare that somebody does not see some improvement. And sometimes the improvement comes slowly. It's going to take weeks or months to turn some of these things around. And then sometimes, the nice thing is you can help reduce the pain. And if you can reduce the pain quickly, that's a wonderful thing, but you still have to heal. David writes, does PBM have good results with tinnitus? And that's the ringing in the ear, or some people describe it, all different kinds can be like one individual mentioned to me, it was like a waterfall in their ear, and they have actually had it for 30 years. The individual is 75, and 30 years earlier in the war, he was in one of the shells went off somewhere, and it caused this ring, in this case, waterfall in one of his ears. Interesting thing enough is he did put the helmet on. Now, a person could use the palm, any one of the three that I mentioned, to treat the inner ear with, let's say, a 3-minute treatment on the near infrared, whether it's 810 or 1050. But in this case, this individual, they put the helmet on, which treats the whole head at the same time, basically like 10 of the palm lights all the way around. And in 3 minutes, he saw for the first time in 30 years, the noise level on that ear had almost totally disappeared, and he could hear through that ear. Now, it came back after 24 hours, but he would need to continue to treat that. And I don't know, maybe he'd be an individual that would need to treat the rest of his life for that. But how much better to be able to hear if that's what it takes to do a treatment in 3 minutes of time, 2 times a day or 3 times a day in the beginning. That doesn't sound like a too bad of a deal. So yeah, there's now newer stuff coming out, and there's a couple studies that are going to happen that I'm aware of, where they're going to look at tinnitus as a full out study. But I can tell you my odds right now that I've had are out of 10 people, and this is literally 10 people, I've had 8 people so far notice a significant difference in their tinnitus since they used the light on their ear. Okay, Nancy writes, can you tell us how much time you should spend using the palm? 1 minute, 3 times a day, 2 minutes, 5 minutes. Nancy, it really depends what you're treating. If it's something like your ear or the brain, we're looking at like 3 minutes of time with the near infrared to reach the area. Now, if you're trying to do a larger area because of migraines or those kinds of things, you're going to have like 10 areas around the brain that you're looking at that you're going to try and treat. So you're going to have to spend half an hour if you're using the palm. If you have a clinic or you have the wherewithal to purchase one of the helmet devices, then you can do that whole treatment in 3 minutes. I had one individual that did a treatment with the helmet, and that was a 3-minute treatment, and they noticed a significant difference in their concussion. The improvements in their healing from a concussion was dramatic. Over 8 days, they went from having really bad signs, dark room, having nausea, headaches, all those kinds of things, to the first treatment where the headaches were gone, and double vision was the other thing. Had to wear a patch on one eye because it was so bad. After the first treatment, when it came in, this was a younger boy, 10 years old, when he did before he did the second treatment, he didn't have the cover over his eye, and in that case, he said the double vision left after the first treatment. Then he did more treatments and another 2 more treatments, and right after the second treatment, he was able to even see across the room where it was a little fuzzy. He could read the writing. Before he came in, he said to me, he says, that far wall, I can't quite read that sign over there because it was a little fuzzy. So that was still that double vision going on just a bit at that point. Did the treatment, and the next time around, after the treatment, right after the treatment, he said, hey, that's clear over there. I can see that clearly. So sometimes this can happen fairly quickly. So I would suggest in areas that, Nancy, if you're dealing with issues with deeper, so if you're talking, sorry, shallow, if you're talking shallow, a couple minutes maybe, like fingers, swelling in the hands from arthritis, or you could do it in a couple minutes. You could do the treatment and have an effect. When it comes to trying to treat an elbow or shoulder, you're going to need more time. So you could be looking at 5 to 10 minutes on the shoulder in one area, and maybe another 5-10 minutes on another area. And you would use more of the near infrared, which is the deeper light, to penetrate. So that's what, and you'd still use some of the red. So I would still use a few minutes of the red on each one of the areas as well, because you're going to be influencing it by influencing the blood by using that light. Okay, so, and then if you're talking a hip, you're going to be even looking deeper than that yet. So thank you for your question. Got a question from Andy. Okay, what would be the average time to use it in area to treat, say, tendinitis? Yeah, I would say you're looking at about 5 to 10 minutes in the area is what you want to do. So you can treat different spots. But if it's something like a hip, you're going to need to be there 10-15 minutes to help get more energy to the area. So that should be very helpful if you were to look at that. And as far as if you can treat more often than once a day, we've been able to see it really help with that kind of thing. To, instead of one long marathon at night, is actually use it 2 or 3 times a day if possible. Especially yeah, in the beginning phases, as once it's calmed down, like back pain or whatever, you still need healing. So then you could probably reduce the number of times, or keep it up and just keep them shorter. That's all. So well, I want to thank everyone for joining us. I want to mention that with all those that have stayed with us to the end of this program, you are entered into a draw at the end of the month. We will be drawing a Super Pum, one of the Super Pum 1050s for $1,900 plus. So it's going to be a free draw for if you join us on our webinars. So thank you everyone for coming. Wish all of you the very best, and that through our light technology, I hope you can utilize it and be able to reduce pain and inflammation, heal some of the areas of their body. And I just want to mention Christmas is coming up, and for those that that have everything, this is an ideal gift for those family members, because this keeps going and going and going, and can help a lot of different issues that people experience in their family and friends. So thank you everyone for joining us tonight, and all the best. Bye for now.